Hi, we're the Women's Health Club, and today we're going to be presenting a video about gestational diabetes mellitus. Okay, so gestational diabetes mellitus, or GDM, is essentially diabetes which occurs during pregnancy. When you're pregnant, there's a huge surge of hormones that are released from your placenta. Examples of such hormones are estrogen, placenta lactogen, as well as cortisol. The increase of these hormones causes the insulin in your body to lose its effectiveness in a condition called insulin resistance. And essentially what that is that your body is no longer able to take in the glucose that is running throughout your body and use it to feed its cells. So essentially, with insulin resistance, your cells start to starve and there's a high amount of glucose in your blood. So you might be wondering, how do I know if I have GDM? Well, the symptoms are pretty hard to notice, other than some increased thirst, as well as an increase in urination that you might notice. But really the way that we find GDM in patients is through checkups in prenatal care.
As you can imagine, gestational diabetes carries its set of risks, both in the short term and in the long term. The short-term risks involved include having a larger infant birth weight, which can result in problems in labor and delivery, an increased risk of preeclampsia, which is a condition where blood pressure rises dangerously high during pregnancy, and an increased likelihood of birth by cesarean section. Long-term, gestational diabetes can have both implications for the mother and the infant. With regards to the mother, GDM can lead to an increased risk of developing type 2 diabetes. According to the U.S. Center for Disease Control and Prevention, about half of people with gestational diabetes go on to develop type 2 diabetes. Gestational diabetes also leads to an increase in the lipids in the mother's blood, increasing the risk of having a blocked blood vessel or a heart attack down the line. There are also long-term health implications for the infant, including developing poor ability to manage glucose as well. Additionally, GDM might lead to a potential developmental and cognitive impact.
So now we're going to discuss screening and prevention, starting with who's at risk for gestational diabetes. So it is important to note that gestational diabetes can develop in any woman who is pregnant, but there are certain risk factors that can increase the risk of gestational diabetes. For instance, ethnicity can increase the risk of gestational diabetes, as women of African, Asian, Hispanic, Indigenous, or Pacific Island descent are at a higher risk for developing gestational diabetes. Age also contributes to this diagnosis, as women over the age of 25 have a greater risk for developing gestational diabetes. Other risk factors include being overweight, having a family history of diabetes, prediabetes or impaired glucose tolerance, having given birth previously to an infant that weighed greater than 9 pounds, previous pregnancies with gestational diabetes, stillbirth, or miscarriage, PCOS, which stands for polycystic ovarian syndrome, or other conditions linked to problems with insulin, and finally high blood pressure, high cholesterol, or heart disease. So typically, if 2 or more of these factors apply to a pregnant patient, they are considered high risk for gestational diabetes. So that brings us to the next question: who should be screened? So it is recommended that all pregnant women be screened between 24 weeks and 28 weeks of gestation. If the patient is at high risk for gestational diabetes, so recall they have 2 or more of the factors that we previously discussed, the screening should be offered at any stage of pregnancy. So typically they might be screened right away, and if the test is negative, they get screened again during the 24 to 28 week time period to determine if they have gestational diabetes. So how can we prevent gestational diabetes? Well, that involves addressing the modifiable risk factors before you become pregnant. So in terms of risk factors, we talked about certain things like age, family history, and ethnicity, but these aren't things that you can control. However, risk factors like weight, physical activity, managing your other conditions, these are modifiable risk factors. So things that you can control to optimize your health to reduce your risk as much as possible for gestational diabetes. So this often involves losing weight if you are perhaps overweight before becoming pregnant, having a healthy body weight, being physically active. These are two main ways that you can reduce your risk of gestational diabetes. So overall, optimizing health before becoming pregnant by having a healthy diet, managing any existing conditions, being at a healthy weight, and being physically active can reduce the risk for gestational diabetes by addressing modifiable risk factors. So if you're diagnosed with gestational diabetes, there are several ways to manage it. And a main factor is nutrition. So nutrition plays a big role in managing gestational diabetes if you're diagnosed with it. So pregnant women with gestational diabetes should be assessed and counseled by a registered dietitian where possible to develop a diet plan that will be suitable to managing their condition. So typically a low glycemic index diet is a recommendation for managing gestational diabetes. A low glycemic index diet consists of consuming foods that are lower on the glycemic index and therefore cause less spikes in blood sugar and help manage glucose levels. Additionally, carbohydrate moderation can help manage gestational diabetes, as consuming various types of carbohydrates has been known to be associated with glucose spikes as well as issues with insulin resistance. Physical activity helps improve both glycemic control and insulin use reduction in women with gestational diabetes. So in conjunction with encouraging good nutrition, it's important to provide physical activity that can also be done to help manage the glycemic control and help manage the gestational diabetes. And finally, while these two measures are essential for managing gestational diabetes, doing blood sugar monitoring at home can help keep track of the levels to inform how to adjust and implement management strategies to ensure that the woman is able to control those glucose spikes and those glucose levels and overall effectively manage their gestational diabetes.